Hi guys, I hope you're doing good in quarantine time. I'm getting bored. I never thought I would make videos, but this is me making videos to answer your questions. I think it's better this way too, because sometimes when you're in the chair and I give you information while you're here, it just kind of goes out and you forget what I told you. So I have some frequently asked questions about dandruff. Why we get dandruff, what is it, and how do we treat it? Well, through the years, I've learned that there are different causes of dandruff, and some of them are skin conditions like dermatitis, psoriasis, eczema. Those all cause irritation and itchiness, and that can cause you to scratch your scalp and cause you to have dandruff. And face it, if you have dandruff, you're self-conscious about it. You don't wear dark clothes, you try to wear hats. It's a big deal to some people. Some people are more prone to it than others. So after I talk about what these types of dandruff are, I'm going to go over the shampoos that you can use to help fix them. And I'm gonna leave pictures. Hopefully, I'm learning how to edit videos, so I'll leave a picture so you can take a screenshot and know what to look for and what to use. So dermatitis, it's basically an inflammation of the scalp. It can be red and bumpy, and just certain spots can be itchy, or your whole scalp can be itchy. It could be environmental, it can be seasonal, it could be diet. So that's one. Psoriasis is more like a patches. It comes in patches, and usually it's scaly and you get silver scales, and this is more of like your larger type dandruff, and a lot of times you'll get like just little patches like behind the ear, and then you'll itch it and you'll see like silver flakes. That is definitely something that can be addressed with, if it's really bad, sometimes your doctor needs to prescribe a steroid for you. But if it's mild cases of psoriasis, I've had clients that actually used a certain shampoo and conditioner and it cleared it up in 2 weeks. So it is possible. Another thing is eczema. Eczema is different than psoriasis. Eczema, usually there's little patches as well, and a lot of times they're back here right on the nape, and they'll flare. It could be a hormonal flare, again, seasonal, but with eczema, it's a little bit different. Psoriasis is itchy, but eczema, once you touch it, it just inflames it and it doesn't stop itching. The eczema also oozes. There's like a yellow crust that comes over the skin. And I know it sounds gross, but you know, people suffer with this. And it's not fun. It keeps you up at night. They're embarrassed because of the flakes. So eczema is another thing for the skin disorders that can cause dandruff. So one shampoo that I highly recommend, I love this line, I keep going back to it, it's Nioxin. Nioxin has many levels, and they're for thinning hair. Actually, Nioxin is used for thinning hair. However, it has peppermint, tea tree, eucalyptus oils in the product to help stimulate the follicle, and also while it's stimulating the follicle, it's soothing and calming and cooling all the skin disorders that we just discussed. If you use that for about 2 weeks, you will see a huge difference and feel a huge difference. It's got like a medicine-y, pepperminty smell. You either love it or hate it, but it works. So I've always recommended Nioxin, and I could do a whole other video on the different levels of Nioxin and which one would be best for your type of hair. Nioxin is also used not only for thinning hair, but it's used for a lot of teenagers. The prepubescent years are getting into like oily, greasy scalp. Their hair's dry, but their scalp's oily. They can't control it. One reason why is hormonal. Another reason why is you're washing too much. If you scrub your head too much, your sebaceous glands are saying like, whoa, I need to act more. So then they're creating more grease and oil and sebum, and it's creating an oily scalp. So if you can help it, do not wash your hair every day. Every day it's not good. You want to do every other day. Nioxin balances the moisture in the scalp and the hair. Nioxin is one of those lines where I always tell my clients, don't put conditioner on your scalp. With Nioxin, yes, you want to put the conditioner on your scalp. There's also mousses and things like that that you can put on after you're done washing, shampooing, conditioning, and then you just put the mousse on your scalp, and it's for extra stimulation for those who have thinning hair and want to see their follicles increase. And I have seen this work for many clients. Sometimes it takes up to 6 months to see a difference, but the Nioxin does work on many clients. Some have hair thinning that's due to other things. Nioxin just fixes surface problems. It doesn't fix anything internal. So if you have pattern baldness that runs in your family, it's only going to help a little bit. It's not going to cure that. You would need something like Rogaine, minoxidil, something like that. But that's another video. We're talking about dandruff. Now here's a thing that a lot of people don't realize. Another type of dandruff is a fungus. It's called melasezia, and I see this a lot in my clients who have very, very thick hair. They'll put it in a ponytail all the time and their scalp never gets dry. People that sweat a lot, their head sweats, they wear hats. They'll go to bed with a wet head. So basically it gives a perfect environment for growing fungus. It's damp, it's dark, it doesn't dry out completely. So it's the perfect storm for something called melasezia, which is a fungus, which sometimes can be itchy, but that can also be a problem. So if you have those habits of going to bed with a wet head, thick hair, never drying it, always wearing a hat, always sweaty, you may not have a skin disorder, you just may have a fungus that you need to kill. And a shampoo that I recommend for that is Redken, and it's scalp relief. And I tell my clients, if this is your diagnosis, then you will use the scalp relief shampoo for 2 weeks straight, and before you go to bed or wear a hat or put it in a ponytail, you want to just make sure your scalp is completely dry. Doesn't matter the rest of your hair, your scalp has to be dry. It will clear up in 2 weeks and your dandruff will be gone. I've seen it, and that works. So that's just what I wanted to tell you about dandruff, the types of dandruff and the different shampoos. Sometimes dandruff isn't dandruff. Sometimes it's product buildup where you're not scrubbing enough. A lot of my thick-haired clients or young girls that are just, learning to, wash their hair, they're not scrubbing enough, especially in this crown area. I'll see it a lot of buildup up here in my clients. So what you think is dandruff could be a lot of product buildup. If you have product buildup, you want to use Pureology Purify. This is an excellent shampoo. It's on the pricier side, but it's highly, highly concentrated, and you only use a little bit. So what that does is that helps just gently cleanse all that product buildup out of your hair. And a cleansing product or shampoo, you only want to use like once a week, if that, because it will eventually strip your hair of all of its moisture and nutrients. So the 3 things I recommend are Nioxin for dermatitis, psoriasis, or eczema, Redken scalp relief for melasezia or fungus, and the 3rd thing is Pureology Purify for product buildup, which can also cause flakes. So I hope this wasn't too long. I hope it was educational, and if you have any questions, just let me know. Thanks.